We're going to have our first guest, Dr. Zontos, and Dr. Zontos is from Greece. He is a physician and is a PhD in physics. Dr. Zontos.
Good afternoon, ladies and gentlemen. In this study, I'm going to talk about how the injection of normal saline reduces the skin injury in FUE harvesting, and how to express this quantitatively by using image processing. As you can see from the diagram behind me, the punch always causes wound surface larger than its cross-section, and Formula 1 determines the value of this wound. Before going further, I would like, for simplicity's sake, to introduce two terms: acute extraction, where the punch is placed at a certain angle Z without injecting normal saline, and vertical extraction, where the punch is inserted into the skin at 90 degrees after injecting normal saline, as you can see in the following video. This is vertical extraction. Normal saline is being injected, skin volume expands while density decreases. Now the punch is being placed perpendicularly because the hair follicles have become more vertical. When normal saline has drained away entirely, the skin returns to normal and the wound becomes smaller. However, in acute extraction, the punch is being placed at an angle, causing larger wound and removing more dermis. Then it's reasonable to come to the assumption that the trauma in vertical extraction is less than in acute extraction. So, the objectives of this study are, firstly, to compare the exact percentage of skin mass removed in both acute and vertical extraction. Second, to provide persuasive evidence why the injection of normal saline before harvesting results in minimizing the skin injury to the donor area. And thirdly, to emphasize the importance of image processing in calculating the results. Based on the main idea you have seen in the video and applying advanced mathematics, I found the following formulas. Formula 2, which represents the decrease in the percentage of skin mass removed in vertical extraction, and Formula 3, which shows the correlation between the masses removed in acute and vertical extraction respectively. The latter reveals a dramatic increase in tissue damage at small outgrowth angle Z if normal saline is not used, as you can see in the diagram. And observing the equations more carefully, it is obvious that all the values can be calculated when the surfaces of the wounds are measured. The methodology behind this, based on digital pictures taken of the wound in acute and vertical extraction both, immediately and 4 hours later. An appropriate image processing system was used to accurately measure the dimensions of the wounds caused by a 1 mm punch and statistically interpret the data from 13 patients. Let's have a closer look at the capability of the image processing system. The marked rectangles demonstrate the stretching of the skin before and after injecting normal saline. The software analyzes the digital images and automatically records the surfaces, calculating, in this case, an increase of approximately 29%. At this point, we can see how image processing system works in practice. In the top left picture, you can observe the surface of the wound in vertical extraction right after a graft removal, as has been calculated by the system. Whereas the picture on the bottom right shows the same wound 4 hours later when normal saline has drained away and skin has returned to normal. The trauma has decreased by 39%. Now, we apply exactly the same procedure in acute extraction. The decrease in surface of the elliptic wound for the same patient was recorded at about 6%. All the data in 13 cases is shown in the diagram. the results are statistically significant as confirmed by using the t-test. The red columns represents the mean value of the ground surface immediately and 4 hours after acute extraction, while the gray ones correspond to the mean values in vertical extraction. In acute extraction, the mean ground surface decreases by a little over 10%, while in vertical extraction, the corresponding value decreases by almost 40%. But the most important aspect of this study is the calculation of tissue damage in acute extraction in contrast to that in vertical extraction. By using formulas 1 and 3, it was found that the average mass tissue removed in acute extraction is 356% larger than that in vertical extraction, while the average wound surface in acute extraction is 87% more than in vertical extraction. So then, we can conclude that the image processing validated our theoretical prediction and confirmed that the injection of normal saline prior to harvesting dramatically reduces the injury to the donor area, accelerates the healing process, and minimizes any noticeable scarring to the donor area. Now, let me draw your attention to the last slide, where you can determine from the pictures the effect of acute and vertical extraction to the donor area in two similar cases. Personally, I believe that vertical extraction significantly advances the benefits of FUE harvesting. Thank you very much for your attention.
Thank you, Dr. Zontos. That's great data.